Our stomachs, often considered the heart of our digestive system, are surprisingly hostile environments. Despite the acidic conditions, a tiny bacterium called Helicobacter pylori, or H. pylori, can make itself at home. This bacterium, often acquired during childhood, can lead to a range of digestive problems if left unchecked. Many people don't even know they carry H. pylori, as it often exists without causing any noticeable symptoms. However, for some, this silent invader can wreak havoc, leading to ulcers, gastritis, and even increasing the risk of stomach cancer. Understanding H. pylori, its implications for our health, and the available treatment options is crucial for protecting our digestive well-being. H. pylori is a spiral-shaped bacterium uniquely equipped to survive in the harsh acidic environment of our stomachs. This bacterium is quite fascinating due to its resilience and adaptability. Unlike many other bacteria that would be destroyed by stomach acid, H. pylori has evolved mechanisms to not only survive but thrive in this hostile environment. Its presence in the stomach is more common than one might think, affecting a significant portion of the global population. Its corkscrew-like shape and unique ability to produce an enzyme called urease allow it to neutralize stomach acid, creating a more hospitable environment for itself. Urease breaks down urea, a compound found in the stomach, into ammonia and carbon dioxide. This reaction neutralizes the acid around the bacterium, protecting it from the otherwise lethal acidic conditions. This clever adaptation not only ensures its survival, but also facilitates its colonization in the stomach lining. This allows it to burrow into the protective lining of our stomachs, leading to inflammation and a cascade of potential problems. The inflammation caused by H. pylori can result in gastritis, peptic ulcers, and even increase the risk of stomach cancer. The bacterium's ability to evade the immune system and persist in the stomach lining makes it a formidable pathogen. Symptoms of an H. pylori infection can range from mild discomfort to severe pain, and in some cases it can be asymptomatic, making it difficult to diagnose without specific tests. The discovery of H. pylori in 1982 revolutionized our understanding of stomach ulcers. Before this discovery, the medical community largely believed that ulcers were primarily caused by stress, spicy foods, and lifestyle factors. The identification of H. pylori as a major cause of ulcers shifted the focus towards bacterial infection and opened new avenues for treatment and prevention. Prior to this, stress and lifestyle factors were considered the primary culprits. People were often advised to change their diets, reduce stress, and avoid certain foods to manage ulcer symptoms. However, these measures were not always effective, as they did not address the underlying bacterial infection. The realization that a bacterium could be responsible for such a common and painful condition was a paradigm shift in gastroenterology. The groundbreaking work of scientists Barry Marshall and Robin Warren, who proved the link between H. pylori and ulcers, earned them the Nobel Prize in Physiology or Medicine in 2005. Their persistence and innovative research methods, including Marshall's self-experimentation by ingesting the bacterium, provided undeniable evidence of the bacterium's role in causing ulcers. This discovery not only transformed the treatment of ulcers, but also highlighted the importance of challenging established medical beliefs and exploring new scientific frontiers. While many people with H. pylori infection remain asymptomatic, others experience a range of digestive discomforts. The most common symptom is a burning or gnawing pain in the upper abdomen, often occurring between meals or during the night. Other symptoms include nausea, vomiting, loss of appetite, bloating, and unexplained weight loss. In more severe cases, H. pylori infection can lead to peptic ulcers, open sores in the lining of the stomach or duodenum, the first part of the small intestine. These ulcers can cause significant pain, bleeding, and even perforation of the stomach wall if left untreated. Diagnosing H. pylori infection typically involves a combination of medical history review, physical examination, and specific tests. These steps are crucial in identifying the presence of the bacteria and determining the appropriate treatment plan. The process begins with a thorough review of the patient's medical history, where the doctor will ask about any previous gastrointestinal issues, family history of stomach problems, and any medications the patient is currently taking. This helps in understanding the patient's overall health and any potential risk factors. Doctors will inquire about symptoms, medical history, and potential risk factors such as living conditions and exposure to contaminated food or water. They will also ask about symptoms like abdominal pain, bloating, nausea, and loss of appetite, which are common indicators of H. pylori infection. Understanding the patient's lifestyle and dietary habits can provide additional clues that may point towards an infection. Blood tests can detect the presence of antibodies to H. pylori, indicating past or current infection. These tests are relatively simple and can provide quick results. However, they may not always distinguish between a current and a past infection, which is why additional tests are often necessary. A urea breath test involves swallowing a capsule containing urea, a substance broken down by the H. pylori enzyme urease. This test is highly effective in detecting active infections. The patient will be asked to exhale into a collection device after a short period, and the breath sample will be analyzed for the presence of labeled carbon dioxide. The presence of labeled carbon dioxide in the breath indicates active infection. This test is non-invasive and provides results quickly, making it a preferred method for diagnosing H. pylori. Endoscopy, a procedure involving inserting a thin, flexible tube with a camera into the stomach, allows for direct visualization of the stomach lining and biopsy collection for H. pylori testing. This method is particularly useful for patients with severe symptoms or those who have not responded to initial treatments. During the procedure, the doctor can take tissue samples from the stomach lining, which are then tested for the presence of H. pylori. This comprehensive approach ensures accurate diagnosis and helps in formulating an effective treatment plan. Section 5. Winning the battle treatment options for H. pylori. Treating H. pylori infection typically involves a combination of antibiotics to eradicate the bacteria and acid-suppressing medications to reduce stomach acid and promote healing. The specific antibiotics used may vary depending on factors such as antibiotic resistance patterns and individual patient factors. It's crucial to complete the full course of antibiotics as prescribed, even if symptoms improve earlier, to ensure complete eradication of the bacteria. Lifestyle modifications such as avoiding spicy foods, caffeine, and alcohol can also help manage symptoms and promote healing. Following treatment, follow-up testing is important to confirm successful eradication of H. pylori. Section 6. Shielding our stomachs, preventing H. pylori infection. Preventing H. pylori infection primarily involves practicing good hygiene and food safety measures. Washing hands thoroughly with soap and water, especially after using the restroom and before handling food, is crucial. Ensuring food is cooked thoroughly and avoiding contaminated water sources can also help reduce the risk of infection. In some cases, antibiotics may be recommended for individuals at high risk of infection, such as those in close contact with infected individuals or living in areas with high H. pylori prevalence. Section 7. Navigating the future. Living with H. pylori. While most people with H. pylori infection can be successfully treated and live healthy lives, some may experience recurrent infections or complications. This bacterium, which resides in the stomach lining, can sometimes be stubborn and difficult to eradicate completely. Even after treatment, it's possible for the infection to return, necessitating further medical intervention. It's essential to be aware of the potential long-term risks associated with H. pylori infection, including an increased risk of peptic ulcers, stomach cancer, and other gastrointestinal issues. Peptic ulcers can cause significant discomfort and may lead to more serious health problems if not properly managed. Another serious condition linked to H. pylori is malt lymphoma, a type of cancer that affects the stomach lining. This condition, although rare, underscores the importance of regular monitoring and early detection. Regular medical checkups, especially for individuals with a history of H. pylori infection, can help detect and manage any potential complications early on. These checkups often include endoscopic examinations, blood tests, and other diagnostic procedures to ensure that any issues are caught and treated promptly. Maintaining a healthy lifestyle including a balanced diet, regular exercise, and avoiding habits that can exacerbate stomach issues such as smoking and excessive alcohol consumption is crucial. A diet rich in fruits, vegetables, and whole grains can support digestive health and boost the immune system. Additionally, stress management techniques such as meditation, yoga, and other relaxation practices can further support overall digestive health and well-being. Reducing stress can help minimize the impact of H. pylori on the body and improve quality of life. Section 8. The global impact of H. pylori. H. pylori infection is a global health concern, affecting billions of people worldwide. Its prevalence varies significantly across different regions, with developing countries experiencing higher rates of infection. Factors contributing to its spread include poor sanitation, overcrowding, and limited access to clean water and healthcare. Addressing this global health challenge requires a multifaceted approach, including improving sanitation and hygiene practices, increasing access to clean water and healthcare, and raising awareness about H. pylori infection and its prevention. Section 9. A call to action raising awareness for a hidden threat. H. pylori infection, while often silent, can have a profound impact on our digestive health. Raising awareness about this hidden threat, its symptoms, and the importance of early detection and treatment is crucial for protecting our well-being. By understanding the role of H. pylori in digestive health, we can empower ourselves to make informed decisions about our health and seek timely medical attention when needed. Together, we can combat this silent invader and promote optimal digestive health for all.